Ovarian cancer is one of the chronic diseases of the female reproductive system that, by its form of development, is also distinguished as the silent killer. It is the second most common gynecological cancer, but its mortality rate is the highest due to the absence of strong symptoms in its initial stages. It occurs when the cells of this organ grow excessively, causing malignant tumors that can spread to other parts of the body. Its exact cause is not defined, but there is a greater risk of suffering from it if there is a family history, sudden hormonal changes and bad habits of life. Although it is necessary to perform medical tests to detect it, there are some signs that can help to suspect the disease to facilitate its diagnosis. Next, we want to share in detail the 7 main ones so that you avoid passing them by in case of suffering them. Know them. 1. Abdominal distension. Abdominal distension is one of the initial symptoms of ovarian cancer. Despite this, it is one of the most ignored signs, given that it is also common in common conditions such as digestive difficulties and premenstrual syndrome. It is important to know that when it occurs recurrently, it is convenient to request medical exams to know its origin. The excessive growth of cancer cells produces several inflammatory reactions in the body, and, among these, the abdominal one stands out. 2. Changes in the menstrual period. The analysis of the changes in the menstrual cycle could also be useful to suspect an abnormality in the ovaries. First, you have to consider how regular the rule is, and, from that, verify if there are changes that go beyond normal. If you start to notice that they are too irregular, it is best to consult the gynecologist to check what may be producing them. Keep a menstrual calendar handy so you can more accurately record the dates between one period and another. 3. Pelvic pain. It is a little alarming to consider that pelvic pain is due to cancer in the reproductive system. However, it is good to consider it as a possibility, especially if it is accompanied by other irregular symptoms. Often, those who develop ovarian cancer feel pelvic or abdominal pain recurrently without an apparent cause. The pain remains for several weeks, almost always manifesting intermittently. 4. Digestive difficulties. Women who develop ovarian cancer not only start to have strains and a feeling of pressure in the stomach. Due to this disease, other digestive difficulties can occur which are often confused with infections or pathologies of this system. It is important to consult in case of continuous episodes of chronic constipation, indigestion and colic, nausea and vomiting, changes in stools. 5. Sensation of satiety. Changes in cellular activity of the ovaries are often accompanied by loss of appetite and marked decrease in body weight. The development of malignant cells causes sequelae in the digestive activity, and, as a result, the patient feels satiated, even when eating small portions of food. This situation is quite dangerous because, in many cases, it causes severe nutritional deficiencies and anemia. 6. Pain during sex. As already mentioned, ovarian cancer brings with it inflammatory reactions in the tissues that, in this case, could be the reason for pain during intercourse. While there are many reasons why this symptom can occur, it is essential to know that one of its possible causes is this disease. Pain manifests itself recurrently during sexual intercourse and is usually accompanied by vaginal dryness. 7. Urgent and uncontrollable urination. When this disease occurs in the reproductive system, it is common that there are sudden changes in urination habits, even becoming an uncontrollable act. The inflammation that occurs causes a weakening of the pelvic floor muscles, reducing the capacity of the bladder to retain urine. As a result, there is a constant need to go to the bathroom, even a few minutes apart. As the disease progresses, patients may also have more episodes of cystitis and urinary tract infections. Do you identify these symptoms? Remember that, although they can alert this disease, it is necessary to analyze them with the help of a professional, since they are also common in other conditions of the system. If you present risk factors or some other reason to suspect, get regular medical checkups as a preventive.